Are you suffering from chronic pain? More importantly, are you suffering from chronic pain and you take a common antidepressant? Because in this video today, we're going to be looking at a study that examined people taking common antidepressants, and we'll go over the three different ones in particular, and patients that were also taking with it ULTRAM or tramadol for chronic pain. And we're going to look at a specific factor that actually led to more pain and four times the amount of pain than the average person that was in this study, and how it affected their whole hospital stay. Let's jump right on into it. So once again, we're going to be looking at the common antidepressants and patients that were taking ULTRAM or tramadol and how it was affecting their pain level through taking these specific antidepressants. But we'll also relate it as well to potentially patients needing stronger medication in regards to pain management when taking some of these medications. So first and foremost, I'm not even going to try to pronounce the name, but it is the CYP2D6 enzyme. You might say, what does that have to do with anything? Well, first off, it can affect this enzyme. Everyone has it, can affect how you respond to pain. But more specific, it's an enzyme that catalyzes the metabolism and elimination of a great amount of drugs. In particular, we're going to be looking at antidepressants, but it also affects neuroleptics, which are antipsychotics, opioids, etc., which once again, in this example, antidepressants and tramadol. Also responsible for 25% of clinically used drugs. So this once again is an enzyme that if you, for example, have a genetic problem, or for example, there's a problem with your gene sequencing as well, this could potentially also cause problems with how your CYP2D6 enzyme reacts, and might actually inhibit some medications from being metabolized the right way. Now, in 2019, there was a study that found more patients who were taking, for example, fluoxetine, and these are all antidepressants, fluoxetine, paroxetine, and bupropion, which is Wellbutrin. It was causing them to inhibit this enzyme. So, in other words, this CYP2D6 enzyme is inhibited when taking fluoxetine, paroxetine, and Wellbutrin. There's some other medications that inhibit it as well. Now, with this, I'm just going to say when antidepressants that inhibit this enzyme with tramadol, and specifically when they were taking tramadol with it, it led to increased pain levels. Reason being because tramadol heavily relies on the activation of this enzyme. So, meaning that there's a drug interaction. So if you're taking fluoxetine or Prozac or Wellbutrin, these specific antidepressants or mood stabilizers in particular, and you're taking a pain medication, and in this example we're just looking at ULTRAM or tramadol, but this does refer to other opioids as well, which it can affect, since tramadol heavily relies on this activation, and these medications right here inhibit the activation of the CYP2D6 enzyme. It was showing that it leads to more chronic and more aggressive pain, which just leads to more problems. Because a lot of times, remember, antidepressants, a lot of times are people who have major depressive disorder also have things such as chronic pain. So it found that tramadol heavily relies on the activation of this. Once again, a lot of other medications rely as well on this type of activation as well. Now, real quick, I did write on here too, providers should keep in mind that patients taking these that inhibit the enzyme or inhibitor meds, if they're taking these inhibitor meds, they might need to be given stronger pain meds, and in particular maybe stronger than things such as NSAIDs. So they might have to take stronger opioids. Now obviously this study didn't account for if there were problems with people seeking medications and whatnot as well, but what it ultimately was showing, as stated, was it was a retrospective cohort study, which it's a study that they look back on back on the results over a period of time. And it's typically, it's like secondary analysis, but the two factors they looked at once again were these antidepressants that inhibit this enzyme, and they were taking tramadol for chronic pain, so depression and pain. And what it found in this retrospective cohort was patients over the time of their hospital stay, which it didn't emphasize how long their hospital stays were, but had 4x the amount of pain. That's what the thumbnail shows. That's why I put the thumbnail 4 times the amount of pain. And also, it was showing essentially that 4x the amount of pain in regards to if they were taking medications that inhibit this enzyme. So once again, as stated, Prozac, paroxetine, Wellbutrin. There are others that inhibit this as well. But there is a good thing. If you notice you might want to talk to your doctor about this. If you're taking one of these medications, and there are more that inhibit this enzyme, but one of these 3 antidepressants in general, you might want to talk to your doctor if you're having chronic pain, because there are SSRIs that actually do not inhibit this enzyme. There are some that actually help activate the enzyme, which could actually help with your pain. And some of these, which were Sertraline or Zoloft, Lexapro, or Celexa, which is Keppra, which these are other meds that are used for mood stabilization, and they're antidepressants as well. So these meds have been shown, once again, they don't inhibit this enzyme, that inhibit the CYP2D6 enzyme. It actually initiates and helps activate it. Because remember, a lot of pain meds in this, once again with tramadol in particular, and there's other opioids that require this as well, that rely on the activation on this. If you're taking an antidepressant or a medication that is inhibiting this enzyme, that could result in prolonged pain and just greater pain levels in general. So my whole point to this, once again, is you just keep this in mind if you're suffering, because a lot of times what you might not know is somebody who has chronic depression or major depressive disorder, they might also potentially be suffering with chronic pain. And depending on the type of antidepressant they're taking, it could be inhibiting the enzyme, the CYP2D6 enzyme, which once again is responsible for the metabolism of certain medications in regards to this certain pain meds. So if the enzyme isn't being activated, as stated with tramadol, or even opioids, if you're taking that with some of these inhibitors as well, these antidepressants that inhibit, you might potentially have higher pain levels. And there are genetic conditions that can, in general, inhibit this enzyme from being able to be utilized the correct way. But it's just something to keep in mind. I wanted to let everyone know. So if anyone's suffering from chronic pain and depression and you're taking fluoxetine, paroxetine, or Wellbutrin in this example, to maybe talk to your doctor about this, because unfortunately a lot of times doctors do think that people are seeking stronger pain meds, when in reality it could just be a quick adjustment, but sometimes an adjustment in their antidepressant, or switching them an antidepressant, which could make all the difference in your depression and your pain, because those two factors go hand in hand again. A lot of times if you're in severe chronic pain, your mental health might not be near as stable as well, leading to higher anxiety as well and depression levels. That is your daily dose of mental health. Like and subscribe. We have the DT's video coming out in the next 2 to 3 days as well. It's almost done. Love you all. Leave a comment if you're taking an antidepressant and you're noticing as well you're taking something for chronic pain with it, and if you've noticed your pain levels not being addressed the right way. Like and subscribe.